So she'd been in to see her doctor for the checkup and the scan, and everything was fine. And he couldn't believe that she wasn't in the wheelchair anymore. And she came out, strolled past me, gave me a cheeky wink, and I thought, oh, okay then. That was effective, 1 hour total, and she can breathe. So he calls me into his office after she leaves, and I think to myself, I'm like, well, this can't be good because, he's a top consultant and he's never talked to me before. So anyway, I'm thinking, well, that's it. Lost my job. Oh, well. But it was worth it because she was out of her wheelchair. But instead, he handed me a list of patients. And he said, this lady can't brush her hair, and this lady can't reach up in the cupboard for a mug. And this one is in excruciating pain all the time. I want you to see them. And so I did. And so that's the story of how I became the scar queen. And then from there, in my other clinics, people started coming for, non-surgical scars. So I saw burns and a gunshot wound to the abdomen, C-section scars and just all types of people came out of the woodwork. And so then that's the story of the scar queen, quite by accident.
It's amazing how your calling found you. So, through your own scar journey, and essentially realizing that there's no support post-surgery in terms of how to manage a scar. And then years later, working in the hospital, you come across this lady who's in desperate need. She finds you. Yeah, it's just such a remarkable story. It's so inspirational, and there's a strong need out there for you. And I'm sure the listeners that are tuned in that have, got some scar that they're either got some shame or resentment associated with it. And this episode is really about helping them and how can we empower them. And you are the scar queen. So it's so great to have you on, and really keen to get into the episode of does your scar cause you pain? And let's start with this, I guess, a scar, the healing process, and then what listeners can do to best move forward with their issue or scar.
Okay, terrific. Ideally, in a perfect world, I would have everyone prepare for surgery. So you want to take about a month to 6 weeks to eat really well, to get enough protein and vegetables and cut out the junk. Try and get rid of sugar and trans fats and alcohol as best you can. This just sets you up so that you will heal faster and you will heal better when you get out of surgery. Now, of course, not every scar comes from surgery. We have accidents, we have burns. We're not given advance warning. So what we do in that case, because that's a trauma, that's going to catch you off guard, really, is you need to consider that there are 4 stages of wound healing. So, you first cut yourself and you bleed, and then your body stops the bleeding, and you go through 4 different stages. And the one that we're really interested in is the final one, which is known as the remodeling stage. The cool thing about this stage is it takes 2 years for your scar tissue to find its final position. So that gives you a lot of time to work with it. So if you notice that it's getting lumpy, or it's getting sticky, or it's getting painful, you have time that you can adjust it, you can heal it, you can make it better. You can make it feel better, and you can make it look better. One of the things that I want to point out is your body, as it heals, it will potentially, and this is more so over joints, so like knee surgery, shoulder surgery, it shoots out what we call adhesions. And these are fiber spans of scar tissue. And the best analogy is a boat in choppy water. So let's say you're in the harbor and your boat's all over the place. That's your scar. Your body is going to try and stabilize that scar, and it will shoot out these adhesions, and it'll grab things. So like the lady in the wheelchair, her scars went and grabbed her ribs and held on tight, and that clamped her ribs down. And so many times a painful scar is because of these adhesions, and they're going to grab onto places that they shouldn't. So when we get to phase 2 of the healing guide that I've written, I'll talk about these adhesions because that's massage therapy. But you want to be aware, like you want to get to know your scar. You touch it and feel it and be like, okay, well, what are you doing now? Because it's going to shift and change for 2 years. The other thing about scars is that if you imagine that your body is a sheet of, what do you guys call it? Cling film? That's what they call it in England. Plastic wrap, saran wrap.
Yeah,
You know what I'm
wrap.
talking about?
Yeah.
If you were to grab that, that's fascia. So your scar is grabbing that. So it's like I'm grabbing this shirt, and now you can see it's going to pull on my bicep and my deltoid. It's going to pull all around it. So we want to keep that fascia as smooth as possible. You're not going to get back to pre-scar skin, but you can get pretty close. And so I've gone through the preparation. Another point of preparation, if you are going for surgery, see if you can get in with a physical therapist and do what they call prehab. So everybody does rehab afterwards, but if you can do prehab, they're going to strengthen the muscles around where you're going to get the surgery. And that also has been clinically shown to dramatically improve your outcome of surgery. Okay, so in my guide, I take people through 3 phases primarily. And phase 1 is the first 2 weeks after surgery. Our main point here is to avoid infection at all costs. Everything you can do to not upset the wound, okay? Because if you get an infection, basically the skin cannot grab itself as easy. And so you end up with a wider, messier scar, if you will. It's not going to be that nice clean cut from surgery. So you avoid infection by doing everything that your doctor tells you to do as far as cleaning, whether it's using the antibac soap, whatever it is. My suggestion is after you wash your scar, or however they've told you to care for it, use a clean hand towel or washcloth, pat it dry, put that in the laundry. No cross-contamination of toothpaste mouth on your towel that then goes on your scar, okay? You've got to be really careful about this. The other part of phase 1 is there are different supplements that I recommend. So yes, you're eating your healthy diet, you're eating plenty of vegetables, and you're drinking your water and doing all that good stuff. You also want to boost your immune system as best you can. And so we do that by lowering inflammation. So we can use things like garlic and turmeric. And those help to reduce the inflammation and just that heat that's around your scar. There are 2 other main supplements that I really like in this beginning phase. You can actually start them in the preparation phase. And that's essential amino acids and collagen. So both of those are shown to speed healing. And for the essential amino acids, it helps to prevent muscle wasting. Because if you're recovering from surgery, you're just lying around. You're not really moving much, depending on how bad the surgery was. And so particularly for athletes, you want to avoid losing your hard-earned muscle. So that's a really important one. And collagen, they've shown scientific. I have a bunch of scientific studies because I'm a geek that likes to read that stuff. So there's tons of stuff on collagen, many studies on collagen and how it helps the body knit together that scar. So it helps the skin actually get itself back together, if you will, and helps that scar matrix, which is going to give you that flexible scar that's less likely to be painful. In that first phase, I also talk about what to do with painkillers and constipation, because that's going to happen. And then also what to do if you do get an infection, how to take probiotics with your antibiotics so that you cover the bases. Yes, your antibiotics are going to clear everything out every time you take them, but then a couple hours later you take a probiotic and support your immune system, because a lot of your immunity is in your gut. So you want to protect that immune system until your next dose of antibiotics. I also use homeopathic remedies in this beginning stage. Arnica is our primary one for all soft tissue injury, as well as just general shock and trauma. And then there's one, and I'm going to hopefully get the full name. I know it by its nickname, Heparsulpharis calcareus, I believe. Everybody knows it as Heparsulf. And that's our main one to avoid infection. So those are the two remedies, as well as the supplements, as well as using a fresh towel. Now, there are other things that you can do to activate your lymphatic system, which is going to help your immune system. And without getting off track, because that's an entirely different guide called Love Your Lymph, that you can do deep breathing. Deep breathing, and if you can maneuver yourself, stick your feet up the wall. That's a great way to activate your lymph, because you've got gravity, and the lymph will be draining from your legs down. Really good for your immune system. So that's basically phase one, is how to not get sicker than you already are. Okay. Now we start phase two, so that depends on each individual. Phase two starts when the scab falls off. So you wait until your stitches are out, you wait until everything is fully healed. Some people will tell you, oh yeah, just pop a vitamin E capsule and squish it on your scar, and please do not. That's risking infection, and you don't want to do that. So I won't even touch anybody. I have a clinic here in Crested Butte, and people call me and they say, I've got this scar. I just got out of surgery. And I say, is there anything pink? And they say, what do you mean? I say, is there anything that's still open? Yeah, well, it's almost there. I say, okay, call me in a week. And even then, your scar is so tender. It's baby brand new skin. Your body has just knit this together. It's so fragile. So we start really easy. So the first couple of weeks, even after the scab is off, stitches are out, doctor said, yep, you can put stuff on it. It's, if you can see, it's like tiny, gentle circles, right? It's just the smallest thing. Right now, it's almost like a polite introduction that you're saying, hello, nice to meet you. You're new here. Let's get to know each other. Okay, very gentle. And there are different oils that I like. There's one here in the States. I'm sure you've got ones in Australia that are, for scars. But if you can't find one, don't just pop a cheap vitamin E capsule. Don't do that. Please don't do that. You guys have a company called, I believe it's Trilogy, which is a gorgeous, it's a gorgeous rosehip seed oil. And that's a beautiful, beautiful oil. And that's the one that I used to use in England. So I would buy it, from Australia, have it sent to London. That's a perfect oil to use on your scar. You want to nourish it. And so rosehip seed is very nourishing, and it helps with the flexibility of your scar. It helps heal it, as well as reduce the redness. It's an anti-inflammatory, and it's going to keep it nice and flexible. So in the course, or in my guide, I'll take you through, I've got videos in there of how to massage a scar. And so we start, like I said, with those tiny circles, and it's very gentle. And what we're also looking for, if you remember, I talked about the adhesions, the ropes that you get. So now you're going to start, particularly if it's like a knee scar, let's say. So, your knee is going to be moving. And so the scar is going to try and stop it from moving, because it's trying to heal itself and knit together. So you want to find these little cords, and it'll feel like little tiny ropes. And you just gently stroke those as well and try to flatten them out. And it's like, okay, guys, I appreciate what you're doing. I understand what you're doing, but I can't let you become a tight sinewy thing, because then it's going to impact the movement of the joint. And I'll get people we get a lot of knee surgeries, as you can imagine here, ski accidents, mountain bike accidents. So I get a lot of knees here. That's what I primarily do. And you'll need to get those adhesions, because then people either can't bend their knee all the way or straighten it all the way. And then that impacts their ability to go out and ski or hike or whatever. Not to mention it can cause chronic pain because your knee is not moving as it's meant to. So the adhesions are just as important as the scar. So you work about an inch, you work the scar gently, and then you come out about an inch to either side. And then you feel around for those adhesions. And that's kind of it in a nutshell. You've got your nutrition, you've got your supplements that are, they're targeted nutrition. It's targeted for scar healing. One other thing that I suggest people take is omega-3, so fish oils. And the reason for that is that fish oils keep the walls of your cells flexible, nice and juicy and bendy. So you want that in your scars. You want them to be bendy. Okay, when you get a stiff scar, that's when the fascia is affected and the joints don't move, and it starts to pull your shoulder down, and then you get neck aches, and there can be so many things that, quote unquote, go wrong because of a scar in far different areas of the body. So you want to keep that scar nice and loose and flexible. So we've got our nutrition, we've got our supplements, you've got your massage techniques, you've got your massage oil. And then I take you through, like I said, I've got the videos, I've got healing visualizations that I recorded, because if you can get your mind and emotions in the healing, it all goes better. So I'll have you visualize this beautiful scar that you're working on while you're doing your massage. I'll give you visualizations for just general healing, so that if you're thinking, man, this has taken a long time, because it does. I had hip restoration surgery a couple years ago, and 8 weeks on crutches. And even the scar queen, started to lose her enthusiasm for the whole experience. But it all worked out really well. So then after you're going to get in a groove, and I've got sort of a daily sheet for you to follow. So it shouldn't be too much. You're not spending hours of time doing massage. In the beginning, I want you to just do 5 minutes 3 times a day. And that is to, create a habit, because I want you to do this for the rest of your life. Remember, certainly for 2 years. Your scar is going to take 2 years to figure itself out. If you start with 3 times a day, that reduces the chance of adhesions. It reduces the chance of the scar getting stiff, which is what makes it painful. It reduces the trapping of nerves within the scar tissue, which also makes it painful. Like you'll get these zinging pains or this burning pain, and that's usually that a nerve is getting pinched in scar tissue. So by the time we get to phase 3, that's maintenance. And that's when you start to drop off certain supplements if you don't feel like taking them anymore. And we get you down to 2 5-minute massages a day. And if all has gone well, you won't need to go into the other parts of the guide, which is what to do for old scars and difficult scars, because they're not all easy, right?
If those listeners have got those old and difficult scars, is that something that's covered in another course or at the end?
No, it's in this one. It's still in this one. The difference with old scars is that they have established themselves in a set pattern now, and they're very happy. Thank you very much. They don't have that flexibility, and so the main difference is it hurts more. I'm sorry to say, because you need to use more pressure to break up the scar tissue. And that's another reason I'd really like people to start caring for their scars when they're fresh, is that you don't have to get in there. Some of the people that come to me with, very old scars, it hurts as you're breaking up scar tissue. It can, like I said, it can feel like it's burning, or it's, that kind of sharp pain. They do free up. They do loosen. They do give. And you can stretch them out, and you can get them much better than they used to be. So I take you through different massage techniques for old scars. And there's also a different homeopathic remedy that we use to break up scar tissue. So the other part of the guide is what to do for burns. So burns are a completely different type of scar tissue. So there's a way that we massage burns, and I show you how to do that, how to do burn scars. And then also what to do for internal scars, because let's say you've had bowel surgery. There's a good chance that there'll be some internal scarring and internal adhesions, and they're going to stick to other organs and things that they shouldn't, right? And they can impact and pull the organs in the body, because all of the organs are surrounded by fascia. So this fascia is around everything. You've got many different layers, but so your organs are all suspended within your cavity, your abdominal cavity, by fascia. And so that fascia can get stuck and pulled out of place. And so I have suggestions on what to do for these internal scars, as well as what to do for vaginal or rectal scars. Because again, it's not like you can really massage those. I mean, you can, but you need help. There's different instruments there. I've got a great source in there for different things that you can do to help free that scar tissue, because you get, quite often I've worked with people who've had rectal cancer, and yeah, sitting down is excruciating. Mm-hmm. So you want to be able to free that, right? So you want to get back to life. You want to get back to freedom and get on your bike and do whatever it is that you love to do. And so, yes, within the guide, and it's natural help for tight, painful scars, very straightforward. It's 5 different therapies, and I teach you how to make them all work together, because I don't think that there's just one. I don't think that you just do one thing and it's all going to be fine. I think that you need a blend of therapies to help your scar, ideally from the beginning. Ideally, you'll get right on it. And I'm trying to fill this gap, because you go to a surgeon and they are brilliant. Obviously I couldn't correct my hip. I tried, believe me, I tried for about 10 years with natural therapies, and they're like, yeah, you've got shark's teeth in there. There's not much you can do about that. But I knew what to do to get me from, he's done his expertise, and he's cut me open and cleaned me up and sewed me back up and sent me on my way. And I've got my physical therapist, and she was brilliant with the rehab. But no one said, well, now what am I going to do with this injured skin? What am I going to do with the tunneling scars? So we've got arthroscopic surgery now, which is fantastic. And that's what they did on my hip. I've got 2 tiny scars on the outside. However, there's a whole channel under the skin from where they put the instruments. So no one's addressed that, right? No one said what to do for that. So that's why with the guide, I'm hoping that I can give people a faster recovery. They can get back to life. They can embrace their scar and be like, I'm a healer. I'm healed. Look at what my body did, right? A scar is like, look at the incredible power of your body. It's phenomenal. I love them. I love scars.
Absolutely. Whilst you were sharing that story, and you mentioned that analogy of the boat in choppy waters, and how the body then seeks to stabilize the boat, which is the scar, as you said, and then it's drawing like little strings or fiber or tissues to that to stabilize it. It's fascinating to think how the body just works its magic and does this. I had a question. You mentioned like pre-surgery, how you could best prepare for it, and that was, cleaning up the diet, cutting out the alcohol. I was thinking post-surgery and in that 2 years remodeling phase, that would also be very important, right?
Absolutely. Absolutely. The longer, you're probably on the same mission. The more I can get people to eat well, everything gets better in life. Yeah, everything. It all starts with food. I studied nutrition after I studied homeopathy, after I studied massage. I kept getting these cases, and I was like, until I get your diet sorted out, it doesn't matter how many supplements you take. It doesn't matter the skin care that you're using. You're putting $100, dollops of cream, but you're eating Twinkies. Like you're not going to have nice skin. I can promise you that. So yes, the longer that you can have a healthy diet, and I'm all about the have the birthday cake on your birthday and have the champagne at your wedding. Absolutely, all of that. If 90% of the time your diet is nourishing, you're going to heal much faster. You're going to recover better. Everything's just going to work better in your body. You'll have less inflammation, which is the basis of all chronic disease. So they believe now. So the more that you're eating whole foods, not a lot of processed foods, your body's just going to work better. So yes, 2 years and beyond. I mean, ideally for the rest of your life, and maybe you'll get hooked on it. That's kind of the point. That's the hope. And I have a couple of eating plans. I've got a couple of guides on that, and people who want to introduce more plants, they want to go plant-based. And I'm not saying vegan, but plant-based, which is just adding more plants, and how to sneak them past your kids. So yeah, there's, the more that you eat that way, the better everything is, including your scar. Absolutely.
And we haven't touched on sleep, but given sleep so essential for recovery and maintenance of our body, that would also be a key factor to.
So sleep and water, absolutely. Yeah. I tell people when they're healing from surgery to not, if you can, if it's possible, you change your attitude that. So for me, it was 8 weeks on crutches. So I knew that was 8 weeks that I was out of commission. And so I took that time and I was like, my job right now is to heal. So that was my mentality. It was like, I have to do my physical therapy and my massage and my supplements and my eating and blah, 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 all of that. And if I'm tired, I have to take a nap. It is doctor's orders. So yes. So if you're tired, that's your body saying, I need to check out your brain for a little while. I need you to just turn off and go away so that I can get busy with repairing you. And, you might not sleep well. I was hooked up to some weird hip mobility machine for 8 hours. And so I did it at night. And so my hip was in perpetual motion for 8 weeks while I slept. And so that meant that I slept a fair amount during the day too. I took naps when I was tired. And if you don't have time for a nap, you can do a 10-minute meditation. And it's to turn the brain off, which allows the body to recover. And yeah.
Fantastic tips.
Sleep is essential. Sleep and rest. So rest is your meditation, your naps, I'm just going to sit on the couch and read a book. That's rest. That's fine. Don't try to push yourself through your recovery. Let yourself rest. And then the other point is hydration. So as much as yes, it was a total pain to have to get out of my contraption to go pee, but you want to have enough water because that's flushing out the toxins. It's keeping the lymphatic system fresh and healthy, which you need for your immune system. And I I don't know what they pump me full of, when they knock you out for however long. So you want to clear that out. So yes, lots and lots of water. That would be a good idea.
And just you've touched on the detoxification process and the lymphatic system and the importance of keeping the lymphatic system in motion. Exercise plays a key role in that, or movement does. So what sort of movement do you I mean, obviously it depends on the surgery, where the scar is and things like that, but what's your recommendations around movement and healing?
I have a whole separate guide on that. There's a whole separate course. It's called Love Your Lymph. And I split it off because the scar one was just getting too long and too much information, if you will. So I split it off so that people who are interested in lymphatics, so a lot of breast cancer patients will have lymph nodes removed. And so it's the way that I describe that is it's like the garbage removal of the body. And so when you have lymph nodes removed, you've had garbage trucks taken off of your root. So you need to make sure that the other ones are in really good shape, and you need to make sure that your roads are really good. You need to keep everything else moving very well. And so depending on your surgery, you can have in that guide, that's mostly video. And that is friend-assisted exercise. So if you can't move yourself, let's say you've had really bad surgery, very extensive surgery, you can have a friend come in and they can move your legs for you in a certain way, or they can, just roll your neck for you because you might be really out of it. Once you get out of the hospital and you're able to move a bit better, I do have, I think it's 12 moves, and it's 12, I call them the Love Your Lymph moves, and it's based on yoga, but keeping it very flowy. And the concentration of the movement is to primarily activate the lymph nodes in the armpits and the groin. Those are our biggest ones. So those are the ones we want to keep those very active. It's not like a strenuous yoga, like not at all. There's a lot of breathing because deep breathing also activates the lymph in the chest wall. So there's that, and failing all else, like I said, stick your feet up the wall. And if you really want to go for it, just like do frog legs, which is where you bend your knees. And the movement in the legs and the gravity, that's going to help flush your lymph. So yes, you've got to do your PT. Do not just sit on the couch and watch movies. I know it's tempting. I wanted to do it, but I took the approach that this is my job. And the other thing I'll suggest is that you have a goal. So pick a big one. So you want sort of a small, medium, and large goal. And for me, I picked a mountain that I wanted to climb 8 months after my surgery. And so I visualized myself among those wildflowers that you can only see when you get up that high. And I was like, I will do that hike. And I was terrified on the day because I was like, oh my God, what am I going to do if my hip seizes up and they're going to have to airlift me off of this thing, right? But I just was like, no, I've done my work. And I did my physical therapy, and I did what I needed to do to get strong enough to get up that mountain. And it was the best climb I've ever done.
Fantastic. Wonderful. And I love how you incorporate all facets of health in your guidelines. It's very holistic, includes, mental visualization, getting that mind, I guess, tuned to the direction you want to go to, and be able to see that finish line. And then I guess that aligns the body and the healing process towards that vision. So, it's been delightful to, to chat with the Scar Queen, Andie, and and the listeners at this point. There's no doubt. Actually, before I go on to that comment, I wanted to make PT in Australia. Is it physical therapist, or are you talking about personal trainer?
Physical therapist.
Okay, physical therapist.
Your rehabilitation exercises, which are going to feel like you're a child learning how to walk. but in essence you are, because if they cut you open somewhere, it all needs to figure out again. Your brain needs to figure out where your body is after this traumatic experience. So you have to do your PT, even though, yeah, you're not going to want to. Please do it. It's really important. Yeah.
Fantastic words, Andie. Yeah, so the where I was going was the listeners are hanging for how do they find this guide? You've spoken so much about these guidelines and all your different chapters or parts of this guide in terms of, you know, how to heal your scar, essentially. So, yeah, where can the listeners find it?
Okay, the best place to find me and where you'll get... is home base. Home base is scarqueen.com. So Scar Queen, like queen with a crown. I picked that because it was easy to remember so that I could remember it as well rather than doing my name. But scarqueen.com, and on there you'll have the online guides as well as links to the different supplements that I like. And if you're somewhere else in the world than North America, have a look at what I suggest. And then if you want to find something local, if you're not sure, you can always email me to say, I got your course. I'm in Australia. I'm not entirely sure. What oil should I get? And I will get back to you as soon as I can.
Oh, fantastic, Andie. And listeners, yeah, I'll include those links in the show notes. So you just have to go directly to the show notes and you'll find those links that will take you to the Scar Queen's page. And Andie, it's been such a delightful conversation. I haven't spoken to anyone about scars, and it's such a unique topic, but it's a topic that I feel needs to be covered because people can hide from it or it's sort of, they don't want anyone to know about it and they're not doing anything about it, and they sort of, but it's always bothering them. And the work that you do really makes them love their scar essentially at the end of it. So I think it's much needed, and so glad we did this podcast and chat about scars, and to really get the word out there as to what people can do, as opposed to just, you know, sort of having that appendix or something that they don't really want and they despise, but, you know, you teach them how to love it.
Yeah, there's so much you can do. And it does change once you care for something. And anybody that's had a child or a pet, once you care for something and you give it your love and attention, it will respond. It can't help but respond. And you'll be able to release the tight tissue, the painful tissue. It'll smooth out. Yeah, you can do a lot. A lot of doctors say, oh, well, you know, we're just going to have to cut you open again and do a scar revision. And that's not true. You can do a lot all on your own. And if you're ever in Crested Butte, come and see me.
Thanks, Andie. And to the listeners, thanks for tuning in to another insightful episode of Me and My Health Up. I really appreciate you listening, giving feedback, and we'd love to get this out to more people. So for those that you know that have got these scars that, you know, they're being resentful for, they're great people for this podcast. So please share it with them. Please leave a review. Please connect with Andie. And our mission is to enhance and enlighten the well-being of others, and you can be part of that. So thank you.